What plane do you put breast implants in? Really open-ended question and a really common question. The most common placement is either over the muscle, which we call subglandular, between the muscle and the breast gland, submuscular, which is under the muscle itself, or in a lot of cases now dual plane, which means the top part of the implant is under the muscle and the bottom part is under the gland. There are some other planes such as subfascial, but those three I've mentioned are definitely the most common. And the real question is, why would you choose one over the other? Well, it depends really on the patient and their body habitus. Patients who are very thin, if they have an implant placed under the gland only, then that implant is going to be very visible. Whereas placing it under the muscle means that the takeoff of the implant is camouflaged and it's more natural. Placement of implants under the muscle, however, does mean that when you move the muscle, the implant moves, and that's called animation. And so that's seen to a higher degree with dual plane or especially submuscular placement of the implants. There are studies which show that the rate of scarring around an implant can be altered by the plane the implant is placed, and submuscular placement has less scarring or capture contracture around the implant. And it also depends if we're doing adjunct procedures. So for instance, if you're having a breast implant and a breast lift, generally the breast implant would be at least partially under the muscle so that we can make sure the blood supply as we're doing a procedure is optimized. Dual plane is a great technique for especially patients with ptosis or sagging of the nipple. It is a hybrid where the upper pole of the implant is under the muscle and it provides a smooth transition, and as the implant lower part is free under the muscle, it provides that kind of natural shape of the breast and really fills out that lower pole. So really it depends on what you're after, what aesthetic drives you, what is a sensible decision from a surgical point of view to minimize risks and complications, and it's something that will be discussed at your consultation, but they are the most common planes of implant placements and some of the reasons why we consider different planes in different patients.